Hi, everyone. My name is Dr. Lynn Miller. I'm the NP Clinical Lead for Athabasca University's Nurse Practitioner Clinical Program. I'd like to take a few moments to cover some of the highlights and information that will serve you well as you enter the clinical portion of your program or as you continue in the clinical practicum portion of your program. I'd like to begin by honoring the traditional lands of Canada and Alberta's Indigenous peoples, First Nations, Inuit, and Métis. We honor the land, their contributions, and their important place in Canada. So welcome. Clinical practicum is a critical part of becoming an NP. And for those of you who are beginning Nursing 675, welcome aboard. For those continuing in your practicum experiences, welcome back. And I'm hoping that you're going to have a good semester as you continue to hone those skills and work towards that goal of becoming a nurse practitioner. Remember that Athabasca's nurse practitioner program prepares you to be a primary care NP. And there's a lot of definitions of primary care, but it's important to focus so that it will help you choose those clinical placements appropriately. So for us, primary care are those community-based services that support health across the spectrum of healthcare and across the lifespan. For many people, it's the first contact for management of health concerns. And the focus is on everything from health promotion to illness and injury prevention, as well as acute and chronic disease management for patients of all ages. Please make sure that when you're out there looking for preceptors in clinical settings, you choose one that fits this definition. Acute care and specialized settings are not acceptable options for this program. And then a couple of other housekeeping reminders. You must use your Athabasca U email at all times when communicating with staff and faculty. And this is Athabasca policy. So personal emails are not acceptable and probably not reliable because they will sometimes be redirected to the spam or junk mail folders. Please also include the clinical course you're completing, which semester, first or second, your student number, and the province where you're completing your clinicals so that your emails can be directed to the appropriate person. It's also important to remember that you are responsible to review and refer to the NP guide for all information, not only about the NP program, but about the clinical practicum experience. And you're responsible to adhere to all deadlines for things like registration, preceptive request forms, course drop dates, clinical prerequisites, and all of this is outlined in the NP guide for your convenience. So let's talk a little bit about this practicum experience. Clinical allows you to make that transformation to a nurse practitioner in primary care and challenges you to integrate theory from the life stage courses into your clinical practice. You'll be supported by a preceptor, and that can be a nurse practitioner or a physician. And it gives you the opportunity to engage in direct patient care with those populations we already discussed. It'll give you a chance to assess, diagnose, and manage well patients. So there's the health promotion, any acute healthcare concerns, as well as chronic diseases. And it also helps you develop those other important nurse practitioner skills, such as critical thinking, leadership, collaboration, advocacy, and research. The clinical courses are structured in such a way that you can blend that clinical practice with the life stage courses over the course of your program. You must complete a minimum of 800 hours, and those hours are divided over 3 courses. Nursing 675 or Integrated Practicum 1 is a 250-hour minimum clinical experience. 676 is 250 hours, and then 678 is that final integrated practicum, and it's 300 hours. You can take up to 2 consecutive semesters for each clinical course. 675 is that first foundational clinical course. So we encourage you to avoid specialty placements. You're allowed one 80-hour specialty placement in the program, but where 675 is that foundational opportunity, it's best to focus on that, honing those basic skills that you've learned in 518 and the other theory that you've done in the previous theory courses. Nurse 678 is that final 300-hour consolidation block, and it must be a minimum of 300 hours. Extra hours from previous courses cannot be carried forward, and that's a regulation from the folks that regulate programs in Alberta. The other important thing to keep in mind, because we're a family all ages or primary care program, is you must complete a minimum of 100 hours for each population group. So they're outlined here. Women would be 18 years and over. Pediatrics is 17 and younger. Adults are 18 to 64 years of age. And then older adults are any patients over 65. Nurse 675 is completed either concurrently with or following nursing 526. 678 is completed concurrently with or following nursing 530. In between these two bookends, the order of your theory courses is at your discretion. However, we would encourage you to mix a life stage theory course and some of your clinical hours. That allows you to learn to apply the theory to the clinical practice. So clinical hours can only be completed during established course dates. So from the first day of the semester to the last day of the semester. The clinical hours can't be completed in that time frame between semesters. And before you start your clinical course, you must receive email confirmation from your clinical placement coordinator that to confirm that your request has been finalized before you start the practicum experience. Any hours that are accumulated without this confirmation won't be counted and could be considered, there could be academic consequences attached to this because you are working without authority of the university. So please make sure you look for that email confirmation before you go to work with your preceptor that first day. Alternative hours are experiences that may not apply to a specific individual patient, but they are related to patient care. So we talk about here, review of lab reports, diagnostic tests, case reviews, things you may talk about with your preceptor. You can apply a maximum of 30 alternative hours in nursing 675 and nursing 676. Alternative hours are not permitted any longer in nursing 678. Again, those are regulations or rules from the organization that regulates our program. Any unused alternative hours cannot be carried forward. So if you accrue 26 in a semester, you can't make up the extra in the next semester. If you accumulate 40 hours, you can only count 30. In the Typhon log, and you'll learn all about Typhon. Janice Young is going to give you some information about that. That's where we log all your clinical hours. You must provide justification in Typhon for what those hours covered. So they cannot be things like a professional development conference, online courses, meetings with pharmaceutical reps, journal clubs. I mean, those are all important, but they do not count as alternative hours because they're not directly related to some portion of your patient's care. So before you start, takes a little bit of anticipation and planning. The clinical placement approval process is complex and it can take up to 6 months to get the contracts with preceptors and the facilities in place. So you must submit a preceptor request form no later than 6 months prior to when you plan to start that clinical. If it's not received in time, you will be withdrawn from the course. So deadlines for the PRF submission are here. So it's March 1st for the fall term, July 1st for the winter term, and November 1st for the spring term. And please remember that you need a PRF for each semester, for each preceptor, and each site, even if you're going to be continuing with the same preceptor from one semester to the next or from one course to the next. The other important thing to remember are your prerequisite documents, and these are examples of them here. Consent forms, CPR and mask fitting, your immunization records, RN license confirmation. These are all outlined in Typhon, and Typhon is the place that you can go to upload these and update them if they become outdated. So as we mentioned earlier, you do 250 hours in 675 and 676, and then 300 hours in 678. You complete a progressive clinical evaluation about every 8 hours of clinical time. In Typhon, these evaluations are also reflected in what we call a case log total graphical report. So this is submitted with the evaluation form that you're going to have your preceptor fill out. And then you both have a discussion about it. You put feedback, your preceptor puts feedback, sign it off, and you submit it to the appropriate Dropbox in your course. The final evaluation for each course is completed when the minimum 250 hours has been completed. And any of the Typhon forms you submit should reflect the entire course. Again, there's information about the specific methods for doing Typhon logs, and Janice Young kindly uploads videos every semester to your course. I'd strongly urge you to have a look at those. That will be your first point of reference. And we're all here to help. Janice is here to help, but you need to look at the videos yourself first. So as I mentioned, I've been talking about Typhon. Typhon's used to submit preceptor request forms, submit and update those clinical prerequisite documents, and to track your clinical hours. It's important to remember that those clinical hours must be logged within 36 hours of the day you were in clinical. If there's a gap, the system automatically times out after 36 hours. So you will not be able to record those hours, and therefore they won't be able to count towards your program. Best to do it the day of. Maybe not at the time of each patient encounter, but at the end of each day while the experiences are fresh in your mind. And remember, when you log each patient encounter, it's also important to maintain your skills list. So if you performed a specific skill, you should go in the skills list and indicate that you've completed it, whether you've observed it, whether you partially participated, whatever level of involvement you had, that should be reflected on the skills list, because by the end of the program, that has to be completed as well. And at the end, for those of you in 678 that can see that light at the end of the tunnel, you have to have a program audit. And this is one final step in program completion. For those of you starting in 675, please remember to keep a copy of all of your original signed evaluation documents and copies of your Typhon log reports, because those need to be submitted in this final audit package. There's an audit form with instructions in Typhon in the document template section, and it outlines how to put this together. For any evaluation that you submit, you need to do it in a single PDF document. So multiple photos of the pages of your evaluation will not be accepted. That will be returned, at whether it's a progressive evaluation or a final evaluation or your audit. You need to scan them or somehow get them into one document, so your clinical course instructor and myself and the audit team, when it gets to that, can have a look and review it. These are some important names that you'll see over the next several weeks and months. Louisa Barton is a program director as I speak. She will be she's finished her tenure and will shortly be moving on. So Deb Fraser will be taking on the program director role, and Deb and I will be working together to lead the clinical program. Sue McKenzie and Sherry Jansen are names that will be familiar for those of you who are in the program, and for those of you that are just starting, I'm hoping you've had contact. Sue looks after the Eastern, so that's Ontario East, and Sherry looks after Manitoba West and the territories. Janice is our Typhon administrator. She makes it sing and dance, and she's there to help after you've watched the videos. Ev Mitten is the Practicum Administrative Professional Officer. Janice DG, we lovingly call her, is our Academic Student Advisor for graduate programs. So she can help with course trajectory, building your program, and she organizes the final audit. And we couldn't live without Erin McDonald and Sarah Wilson. They are part of our support team, and you'll probably receive communication from them. They can also help you navigate any of the questions and all that may arise. So I'm hoping this is helping, just to give you a little bit of a launch. We're here to support you through this. We're here to help you through your clinical. So please don't hesitate to reach out at any time, as well as connect with your course instructor and stay regularly involved with your course in Moodle, because a lot of the communication for the program will go through Moodle. Thanks. Have a great semester.